this is all a way to lead up to the big mama bill, which is the New York Health Act. So give us your elevator speech regarding the New York Health Act. What would it do for the people who are watching?
Well, we already have, we've been on a long elevator ride, because most of what we said, almost every word that has been spoken in this panel is actually a support of why we need to move in this direction. So in a very short, the elevator speech, right? We need to create a system. We believe that healthcare is a human right. We believe that every single New Yorker, regardless of their age, their gender, their wealth, or their immigration status, should have healthcare, period. And how do we do that? In the case of this bill, the New York Health Act, which again is sponsored by me in the Senate, as well as 30 of my colleagues, and in the Assembly by Assembly Member Dick Gottfried and a whole bunch of Assembly members. I don't remember the exact number. I'm sure Elizabeth does. But in any event, what this bill would do is create a single-payer system in the state of New York. Now, you've heard this, so what exactly does it mean? In the current system, you have a multi-payer system, which means that your doctor or provider gets paid by a whole bunch of different potential people. It can be Medicare, it can be Medicaid, it can be private insurance companies, it can be out of pocket, et cetera, et cetera, et cetera, et cetera. This complicated system that is led by a market mentality, because remember, most folks who have insurance have the insurance company's job is not to provide you healthcare, and it is not to guarantee you healthcare. It is to keep as most of that money as you give them as possible. And that means that they deny you care for all sorts of things. That is what they do for a living. That is how they make their money. And so if you take the insurance companies out of the equation and you have a single payer, meaning the state pays the provider. Now, this is not a state-run healthcare system, because people tell you this to kind of scare you off. It says like, well, that means that the state will be providing care. The state will be paying the bills. It would come from one place. Now, this does a couple of things. Number one, it cuts administrative costs, because right now, private insurance companies, of every dollar that you give them, 15 to 18 cents of it goes to administrative costs. That means not only high salaries for executives, that also means all those people who you talk to on the phone who tell you that you can't get access to that because you didn't get the prior authorization, or you didn't, or that doctor is no longer in your network, or that drug is no longer in the formulary. All those people, how about we get rid of them and we actually just have a state entity that will actually pay the bills to the provider? So that in the basic sense, that's what we're talking about. It is about guaranteeing healthcare to every New Yorker. We can do it because we will pay less. As I said earlier, it is a system that costs less because we share the risk among the entire population, lower administrative costs, negotiate on behalf of the entire population with drug companies to get better rates on drugs, and provide primary care to everybody, which means that you will be able to identify chronic conditions earlier. So this is among other things.
So there are criticisms of this bill that I want
to,
and you can respond. And one of them is that, it would compel 20 million people to switch health plans. I like my health care.
Do you though? I'm actually sincerely asking this. Do you though? Are you on a network?
I think, yeah. I think
okay. So that means that you are limited to that network of doctors. And let me ask you something. Did you, as an individual, Susan Arbetter, have anything to decide whether the doctor that you like, that you or your family have been going to for 10 or 15 years, do you have the ability to make sure that that person stays in the network that you're currently in? No, you don't. Okay. How about if a doctor decides that there's going to be some particular medicine that you need to be able to deal with headaches or to be able to sleep or whatever. How about if that drug is no longer covered in the formulary that the insurance has determined?
Yeah, no, all good points. But you know what else I don't like is the paperwork that I would have to go through in order to deal with this new vast bureaucracy that a single payer health plan would have. I'm being provocative here, but how do you convince people who are generally, my healthcare is all right. I don't want to switch. I don't want to do the whole upheaval thing.
So the upheaval, I just want to make sure that people understand what we mean by upheaval. Upheaval means that there's a lot of things that you deal with now that you will no longer have to deal with. Now, you're saying about this whole paperwork and what have you. It is simple. If you are a New Yorker, and we will determine determine who is a New Yorker. We will deal with how long you've been living in the state, etc. And once you are a New Yorker, you will be covered. Period. And a doctor will get reimbursed for the services that they provide you because they're a doctor and you're a New Yorker. Period. We actually want to simplify the system, not complicate it further.
Okay.
We don't want you to fill out all sorts of paperwork, etc. We want you to have a direct relationship with your provider and have the bills for that provider be paid for by the state, and that is it. Actually means it will be simpler, not more complicated.
One other criticism, this is from Bill Hammond of the Empire Center. He said that the bill doesn't provide any clear plan for determining provider fees. Can you respond to that? Actually,
that's incorrect. And by the way, for the record, Bill Hammond, I am a fan of Bill Hammond. We disagree on a whole lot, but talking about a gentleman scholar who is somebody that I can have a debate with for hours and still respect afterwards. They don't make him like him anymore. Bill Hammond is a jewel. I love Bill Hammond. But Bill, you're wrong, bro. And let me tell you why. The bill specifically states that the rates that are to be set by a board. The membership of the board is also discussed in the bill, and the rates have to be in statute. It will be that the rates that will be determined will correspond to what actually it takes, what the care costs, which, by the way, is not the way it works right now. When doctors tell you, well, Medicaid pays too little, you are correct. And they tell you that private insurance pays that much more, you are correct. How about if we equalize that by having a rate that is set in discussion with this board? The rates will be set by them. And because, again, in statute, which exists nowhere else, the rate will have to correspond to what it costs to provide the care. So he is correct that we do not have specifics in the bill language that tell you how much the rates are going to be. But we do provide the mechanism by which these rates will be set, which is more equal, more fair than anything that currently exists in state law. So, Bill, you're wrong, bro. Just saying.
So this is a longer conversation than we have for right now, but we'll leave it there. Are all of you here for the New York Health Act, Elizabeth?
Let me check. Yeah, are we good? Okay. I was gonna say.